Now that we're
What
done
do I
with the
do?
laser,
Do I close my eyes?
no, I will tell you to smile.
Oh, okay.
So we're done with the laser treatment, and this is the second round. Smile wide for me. Smile. Relax. So she's bothered by these little lines here, which I call just baby lines. Smile again for me. Relax. So in the event of bruising, every time we poke, there's always a tendency to bruise. You just ice pack. And then just be gentle with your skincare tonight.
Okay, don't rub it.
Yeah, don't over rub because you want the product to stay where it's injected anywhere.
Can I sleep on my face?
Oh, you know what? One beauty tip, don't.
Don't. Okay.
Not only because we're doing this, it's also another way of, you know, some lines are caused by the way we abuse our face, right?
Mhm.
So if you're sleeping like that, you're on
Oh,
your
that's
face.
me.
In time, you're gonna have those lines. Just like when you crumple paper, right? Constantly doing that, it like that crumbly. Some patients that I've seen, instead of having this horizontal lines, they got vertical lines.
Oh.
Where did you get that from? From your sleeping.
Oh, is
So-
that possible?
Yeah, it can
Oh, I
happen.
hadn't heard that.
Yeah, that's why it's hard. Even myself, I have to retrain myself to sleep all the time, just like here.
Oh, that's
Discipline.
Yeah.
Okay, and then turn to my side. 2 more pokes, and then you're done for the day. Smile wide for me again. Relax. One last smile. Relax.
How did that feel?
It's your first time. How does it feel?
It's just like a regular, just nothing.
Nothing. Good.
Yeah.
You didn't even feel it. Okay, well, that's good to know. So it will start working. Give it like few days. Okay, full effect in 2 weeks.
Okay.
Okay, based on my experience, the crow's feet respond faster to wrinkle relaxer. Yeah,
Okay.
with me maybe on the 4th or 5th day, but it's always like case to case basis. That's why I always tell my patient, wait for full effects 2 weeks.
Okay. Oh, so it's not gonna do it right away then.
Okay. The way I approach injectables, say for example for Botox. By the way, there are several brands already. Botox, Xeomin, Dysport, and Neurotoxin. They all do the same thing. Just relax the muscles so you don't have a lot of lines, okay? But if something that you don't like, it wears out. If something that you like, do it again. So the plus and the minus evens out on the 3rd and the 4th month. So it's not permanent.
Okay.
That's the beauty of doing this Botox. You can inject here, your frown lines, forehead, your body lines. It can also be used for facial slimming, especially if you're a clencher. It gives you headache, and then you will notice, oh my god, it's nice. And we can use it with platysma if you like. If you do that and you have like lines there. I use it for our Gold Blend Skin Boost Micro Infusion, but the manner of injection is different. To reduce pores and also those very fine lines. You can also use Botox for excessive sweating, hyperhidrosis, underarm, palms. There's so many uses. Lip flip, pebble chin, sad smile, anything that you can think of.
Oh, okay.
Yeah, so the technique is how you inject it, how much you inject. Botox is a quick treatment. If you're only treating the upper face, you can come in with your mask on and you're good to go under 10 minutes. And then you got 3 or 4 months of satisfaction. So for patients that don't like injectables, we do have devices like this. We have the laser, we have the trifecta RF microneedling. Those things or those devices promotes collagen, so it's your own body now.